Decriminalizing the possession of hard drugs like cocaine, heroin, meth, British Columbia always knew it was a risky move. But now, Canada's first attempt at a project on this scale, they say we moved too fast. It's not working. We need to walk it back.
In short, this amendment will make public drug use illegal in British Columbia.
It's a major shift in year one of a 3-year pilot. So let's try to understand how BC's experiment has fallen short. The goal of drug decriminalization is to remove the stigma around addiction, to encourage people to reach out for help without fear of being arrested, and to treat addiction as a health issue, not a criminal one.
Do you think this law then today is going to take away some of that stigma so that you
I
can
hope
get the
so.
help?
It's the stigma that needs to be taken away. It's so hurtful.
At the time when the BC pilot launched, a lot of people thought it was a good idea, a compassionate move to help those struggling. Let's bring drug use out of the shadows into the open. But according to police, it was a little too open.
The British Columbia Association of Chiefs of Police has expressed significant concern with the issue of public consumption of illicit drugs.
During the pandemic, we did see a rise in the homelessness population, and we also saw people with addictions starting to use drugs more openly. People are seeing people doing drugs in public, families in front of children, people at bus stops. And so with decriminalization, there's a feeling that some of these things sort of exploded.
BC's premier says open drug use in parks, in restaurants, even in hospitals has become a problem, particularly in big cities like Vancouver. Even some drug users that CBC spoke to agree. Things have gotten out of control.
Everybody's like going, yeah, like we can do anything we want now. So if they thought they were helping them, they're actually, they hurt them 10 times more.
And this, according to the premier, has become a safety issue, even for people who don't do drugs themselves.
The drugs that we're seeing in our communities are more dangerous and more deadly than ever before. People have transitioned from injecting drugs to inhaling drugs. The impacts are very real on communities.
What he's talking about there is secondhand smoke. The person doing the drugs inhales them, but you, if you're nearby, breathe in some of the same toxins. Something like meth can also find its way into your bloodstream that way. And when that's happening in public places, restaurants, on transit, in parks, near children, that's a problem. According to the BC Nurses Union, it's happened several times where a patient is smoking and the nurse is exposed in hospital. One nurse in Vancouver reportedly returned from maternity leave to find a patient smoking an illicit substance in her ward. And that exposure was apparently so severe, she needed emergency care and was advised to stop breastfeeding her infant.
This has been causing a lot of alarm and a lot of concern for health workers who are trying to navigate around this issue.
Now, there aren't nearly as many studies about secondhand smoke from illicit drugs as there are about, say, tobacco smoke. Most health authorities seem to agree, though, while you probably won't overdose from secondhand smoke, there can still be a health impact, especially for vulnerable groups like those in hospital.
Nurses are afraid to go to work because they have to put up with addicts using meth, crack, and weapons in their hospital room. Even nurses are having to give up on breastfeeding because they're worried their kids will be contaminated with the drugs they breathed in. What the hell are they thinking over there?
It's a conversation that's long overdue, but do I feel personally that this is being politicized? Absolutely.
So there's been a lot of public and political pressure on the BC Premier over the past few weeks. And then consider police. They initially supported the idea of decriminalization. But now?
The feedback has been unequivocal. Public consumption is a significant issue that needs to be addressed, and major changes are required.
According to officers, it would happen all the time. They'd approach someone using drugs and say something like, sorry, you need to go somewhere else, you're too close to other people. And when that person refused, they'd have no authority to back up their request.
And police were getting calls, but they felt that their hands were tied.
So BC knew from the start, decriminalization would lead to more drug use in public. What they regret was how it spiraled out of control. But even then, The payoff was supposed to be better treatment, more recovery, fewer overdoses, fewer deaths. Did any of that pan out? In the first year of BC's pilot, decriminalizing hard drugs, the province saw a record number of drug-related deaths, more than 2,500. That's on average nearly 7 a day. Overdose-related 911 calls also went up 25%, the biggest jump on record. And get this, there were 36 days in 2023 where BC Emergency Services got more than 150 calls. Before last year, there were only 23 days ever across all years where they had that many calls.
It's staggering to see the elevation in the amount of overdoses that we're seeing still.
Because I walk down the street on a daily basis and I see people hunched over and you can't tell if they're alive or dead.
What about treatment? The idea is that if you destigmatize drug use, you get more people seeking help. One way to measure that is to look at how many people received what's called opioid agonist treatment, which can help you safely wean off drugs. So we're talking things like methadone, buprenorphine. The provincial data shows so far just over 24,000 people in BC received prescriptions for one of these drugs in December 2023, about the same number of people that did at that time a year earlier. Meantime, long waits for inpatient programs, longer-term rehab, are also a barrier for some. According to the advocacy group Canada Drug Rehab, the average wait time for a government-funded program in BC is 3 to 6 months.
When a person reaches out for help, you have to strike while the iron's hot.
By the time they get back to you, you don't want to go to rehab anymore.
What critics say the province should have done was build up their treatment capacity first. Then, once they were confident that they could help everyone that wanted help, then decriminalization could have come into play.
What the opposition here has been saying is that while the provincial government has been adding more treatment beds, the increase is very slight. They've been pointing at that and saying there should be more treatment coupled with decriminalization when the government had planned to bring it in.
BC's request for an amendment now sits with Health Canada for approval. Once passed, small amounts of drugs would still be legal in private residences and at safe injection sites, but police would have the power to compel users to leave public places, to seize their drugs, and to arrest them if need be. But this course correction already has at least one other province shaking its head.
Drop that application. It's turned into a nightmare. Like letting people do cocaine and crack and heroin. You got to be kidding me.
Toronto is on track to start a similar project, decriminalizing possession. But Ontario's Premier, Doug Ford, now vows to fight tooth and nail to make sure Toronto doesn't fall into the same trap.